Hey, everybody, it's your girl, Lindsay Elmore. I am here today to talk to you about medications that are making you fat. Let's get a better angle on this camera, shall we? Because the fact of the matter is there are so many medications out there that can make you bigger, and nobody is teaching anybody about it. So I feel like we need to discuss it more because so many people are in this situation where they try desperately to get healthy, stay healthy, all of the things. And unfortunately, we're getting sabotaged everywhere along the way. And we are not effectively being taught how do we actually stay healthy. So let's make medicine simple. My name is Dr. Lindsay Elmore. I'm a board certified pharmacist. I practice in functional medicine and I like helping people make themselves healthy. I believe that everybody deserves to be healthy, and the fact of the matter is that the way that the world is set up and structured is not getting us there. So how can we be healthier when there's so many things standing in our way? Let's talk about drugs that cause you to gain weight. The worst part about this is that a lot of these drugs that are causing you to gain weight are actually being used to treat diseases that may have in part been caused by the fact that you're overweight at baseline. One of the things that really comes to mind strongly is medications for diabetes. Insulins, sulfonylureas, thiazolidinediones, all of these medications have been known to cause substantial weight gain when compared to placebo. We think about other medications that are out there, things like metformin and the DPP-4 drugs are considered very weight neutral. They don't cause you to gain any weight. And then there are some drugs that are used to treat diabetes that can actually help you to lose weight over time. But insulin, sulfonylureas, and the TZD drugs, well known to cause weight gain. So insulin causes weight gain through multiple mechanisms. Sulfonylureas increase insulin levels. So in every way that insulin causes weight gain, sulfonylureas cause weight gains because sulfonylureas increase the amount of insulin. We know first and foremost that insulin and appetite can be stimulated. We know that people have defensive snacking when they are on insulin and sulfonylureas because both of these medications can lower blood sugar to the point of hypoglycemia, causing you to be hungry as a way to help you survive. So defensive snacking is one of the main mechanisms of action by which the sulfonylureas and insulin can cause weight gain. We also know that poor glycemic control can change the way our body responds to our metabolism triggers. So we need to improve that metabolic control and help ensure that we are getting the amount of sugar in the blood that we need without it being too much. So let's think about other ways. When we take insulin or when we use sulfonylureas, they increase the amount of fat because they increase our appetite. There is increased eating, increased snacking to help reset and increase blood sugar because both of these medications reduce our blood sugar and it can be to the point of hypoglycemia. We also know that both of these medications block fat breakdown, and because insulin drives blood sugar into the muscles, it's also increasing the amount of muscle size and tone. So here's multiple different ways that insulins and sulfonylureas can cause weight gain. TZDs are another type of diabetes medicine. The average weight gain on these is a little bit less, whereas when you start using insulin or sulfonylureas, there can be a weight gain of up to 8 pounds within that first year. Thiazolidinediones actually increase weight a little bit less, somewhere between 3 to 8 pounds in the first year. And these increase body weight primarily because they cause you to retain fluid. So they're causing you to retain fluid, and then they're increasing the amount of subcutaneous fat accumulation. Now, this can be good because it may help you to reduce the amount of visceral fat, the amount of fat that is in your liver. However, we know that there are not only the concerns about weight gain and about body weight, but there's also concerns about how these drugs interact with our bones and can lead to osteoporosis. And so we need to look out for all of this excessive fluid, which can be very, very hard on the heart. And we also know that these drugs have kind of fallen out of favor just because there are newer, more robust agents on the market. So if you have diabetes and you're still taking a regimen that is primarily sulfonylurea based, these are the ride drugs. So these drugs all end in ide. And so we have glipizide, glimepiride, gliburide. All the ide drugs are the sulfonylureas. And then the TZDs are the zone drugs, the pioglitazone, rosiglitazone. So these medications, if you're primarily on a regimen that is based around TZDs or sulfonylureas, probably time to speak to your physician, your pharmacist, about what are some of the newer agents that are covered by your insurance that can help you to control your diabetes while not putting on excessive amounts of weight. And please note that diabetes is a totally reversible condition. Type 2 diabetes is totally reversible. Type 1 diabetes, totally different story for another day. But we need to think about and remember the fact that there are multiple different treatments out there that can be used, and some of them may cause you to gain weight, other ones may not. Another common drug class that gets prescribed all the time are antihypertensive drugs. Beta blockers can cause weight gain, as well as calcium channel blockers have also been shown to cause weight gain. So beta blockers are the LOL drugs: metoprolol, atenolol, carvedilol, nebivolol, labetalol. All the LOL drugs fall into this category, and they're used to lower blood pressure. Weight gain can be up to 10 pounds in the first year. That is a substantial amount of weight gain. And the reason that beta blockers cause weight gain is because they decrease your basal metabolic rate. They decrease how quickly your body is running, how fast your body is running. They also decrease fat burning after meals, and they inhibit fat breakdown in response to stress. Here's the worst part about beta blocking medicines is that they selectively increase abdominal fat, which is the worst kind of fat that you can have. Calcium channel blockers are considered weight neutral. However, there are a few that can cause problems and cause people to gain up to 8-10 pounds in that first year. Not exactly what we need to see happen. The most quintessential weight gain drug that I can think of is the steroids. Prednisone, prednisolone, beclomethasone, hydrocortisone. These are used to treat allergies, used to treat asthma, and they can cause people to gain up to 25 pounds in the first year. They do this by acting like cortisol. They act like our stress hormones in the body. They increase the amount of food that we eat. They increase our cravings for high fat, high calorie foods. They decrease the amount of fat that we burn, and they dramatically change the distribution of fat, leading to fat deposits up under the skin, which can cause major problems and can be physically altering to the body. Anti-seizure medicines are another big class. So if we were to take a step back, we would have to do another entire class on psychotropic drugs, so drugs that act in the brain. So psychotropic drugs have many, many, many effects on body weight. So antidepressants can cause weight gain, antipsychotics can cause major weight gain, anticonvulsants as well as mood stabilizing medications can all cause weight gain. And they do it because they promote insulin resistance, they promote insulin secretion, and they decrease the amount of adiponectin, which is a powerful hormone that nobody talks about that has major benefits to our metabolism. So these are just a few of the medications that can cause weight gain and may be one of the culprits at why you can't lose weight. So what I encourage you to do, join the Metabolic Makeover Summit. Head to www.lindsayelmore.com/metabolic makeover and learn from more than 30 key experts about how you can take back control of your metabolism and offset the signs and symptoms of weight gain that you may be experiencing because of your medications. Let's get down to the root cause of why do you have diabetes, why do you have high blood pressure, and not just try to band-aid it with medications. My name is Dr. Lindsay Elmore. You can catch me again right here on YouTube. Go ahead, hit subscribe, like this video, share it with a friend who is concerned about medications and weight gain, and I will see you all free and online at the next Metabolic Makeover Summit. Over and out.